Hello, my name is Lynette Mattiacci. I'm a former early intervention specialist, but now I am the coordinator of the Family Resource Center at Pennsylvania School for the Deaf. Hi, my name is Amy Moores. I'm a school social worker at the Pennsylvania School for the Deaf. At PSD, we provide various opportunities for family engagement. As examples, we have a shared reading project, we have ASL classes, parent-teacher organization, and school events that families are invited to. At school events, we had noticed that family participation was uneven, and so we wanted to make sure that we were improving our family engagement. We hosted some professional development with staff to start discussing the ways in which we could improve family engagement among our families. Before we begin, we'd like to acknowledge and recognize that the two of us are white, deaf, women, and that we have different backgrounds. Our experiences growing up have been quite different. Those differences influence our work. That means that we need to be honest and vulnerable when we talk about these things. We need to be open to feedback from other people and recognize that those people's experiences are different as well. How we interact with them and with each other needs to be cognizant of these differences. PSD is in Philadelphia, Pennsylvania. Philadelphia is the 6th largest city in the United States, and it presents some barriers to our ability to interact with families successfully. Some barriers that you may share in common. Those barriers include poverty, different socioeconomic status, wealth gaps, multiculturalism and multilingualism, food insecurity, homelessness, and others. One example of health and wealth disparities is found near the Rocky statue in Philadelphia. To one side, we have an area called Mantua, and to the other side, we have an area called Spring Garden West, separated by about 10 miles. In Mantua, the average income is $25,000 a year, and the life expectancy is 66. In Spring Garden West, the average annual income is $82,000, and the life expectancy is 87. Even though these areas are just 10 miles apart, the lives of their residents are quite different. Some families in urban settings may experience various challenges. Their priorities may be different because of that. As an example, some families may worry about where they're going to sleep tonight or where they're going to get food from. How we engage with those families requires us understanding their needs. We'd like to bring up Maslow's Hierarchy of needs to help us understand those families so that we can better engage with them. Another thing that we should keep in the forefront of our minds is the ACEs paradigm, Adverse Childhood Experiences. ACEs is a tool that helps us to analyze somebody's upbringing and personal experiences. Some of our families that we interact with may have had a high ACEs score, meaning that they have had negative experiences in the past. This is not meant to label these families, but to help us understand where these families are coming from and their needs. If you're interested in learning more about ACEs, there is a great YouTube video and other resources online. You can look at acesconnection.com and sign up to receive regular email updates. We also encourage you to take time looking at your community to find areas where you can spread awareness of the ACEs paradigm and learn more about those who have high ACEs scores within your school setting and amongst your team. Those two tools can be used in your work when engaging with family, the Maslow's Hierarchy and the ACEs score. It's important to keep these in mind because as we work with families in urban settings, their minds may be taken up with important things like where to sleep or their basic needs, and those thoughts can zap the energy that they would otherwise invest in their children for other reasons. And so that tips the scale on their ability to think about these higher level needs. It's then our duty to help these parents tip the scale back in the other direction so that they can support their deaf and hard of hearing children. We've been talking about some possible barriers and challenges that some families in urban settings may face. We'd like to shift now to talk about family engagement. Family engagement as a term can mean many things. It depends on what you do in your job, who you work with, the goals that you have for that engagement, and others. This picture can be seen as a map with family engagement in the middle. If you would, please take a few minutes on a piece of paper to write down the word family engagement and think about the things that family engagement mean for you. You can write down a definition of family engagement. You can write down how it looks in practice, what the goals are for family engagement, who you work with in these settings, what kind of resources you may need to be successful in engagement, and so on. Family engagement can mean many things. It can involve parents, caregivers, grandparents, aunts, uncles, anyone who is involved in a child's life. Research shows that family engagement is extremely beneficial. But let's now talk about what kind of family engagement is important. Positive family engagement can support a child's success, for example, in attendance, test scores, literacy, and so on. In the field of deaf education, language deprivation is a hot topic. How we support deaf and hard of hearing children's language development, and how we support the family's support of the child's language development is important. At PSD, we have an EI playgroup in the family-centered program, where we allow families and caregivers to come with their toddlers. The picture here shows a young child engaging with their family. In this case, the child's grandmother came to the playgroup to see her granddaughter reading a book. The granddaughter was surprised that the grandmother was surprised that the granddaughter had so many signs for these English concepts and was so proud of her granddaughter. This is why family engagement is so important, so that we create a link between what happens at home and in school. As a former early intervention teacher, I worked with families that had IFSPs, Individualized Family Support Plans. Those IFSPs are similar to IEP goals, but they're for the family and how they can support their child's language acquisition and other development. The focus of early intervention is to work in conjunction with the family and partner with them to support their child. We use a lot of coaching, modeling, listening, and supporting to develop that language, that relationship. Importantly, in our practices, we have conversations with families. We ask them what they want from us and how we can support them. We want to know what their hopes and dreams are for their children. The benefit of home visits is that you can actually see their home life and understand the dynamics that may exist there in the child's natural environment. Now the question is how we apply early intervention approaches to the age range in school settings. The American School for the Deaf is proud to sponsor the National Deaf Education Conference, which has created the NDEC Signs and NDEC Engage series this year. During the pandemic, we need to be creative and thoughtful about how we reach our communities, and NDEC has done that for our instructors, administrators, and parents. Thank you. Now, you may be wondering what we mean by applying early intervention strategies across a range of ages. That can mean several different things. It could mean focusing on families and their strengths, focusing on their well-being, focusing on really starting early to start building positive trust with that family, and other things. It could mean using effective active listening and chatting with them, reaching out to the family before negative problems arise. So that might mean at the beginning of the year when you have a new class, you take the effort to reach out to all of those families through phone calls, text messages, emails, and whatnot, to initiate conversation with them, to know who they are, what their hopes and dreams are for their children, and to build that positive relationship, to show them that we care about their children and about them as people. As we set up our practice of engaging with families, we also want to make sure that we take the time and opportunity to engage with families, to understand their culture, their belief, their values, their biases, and any other things that we need to know. We also want to better understand their decision-making process so that we can be more transparent with how it is that we interact with them and that we can support their child's educational journey. This may include understanding their perspectives on deafness, hearing level, communication styles, and preferences, as an example. Sometimes my practices might not align with a family's practice, and so it's contingent upon me to align myself to that family's needs. As an example of how I need to align with families, in some instances, you may call and want to speak to a mother about a child, and the mother defers to her husband, to the father. In my culture, men and women are equal, but in that person's culture, that might not be true. In that family, they may value respecting the father's opinion over the mother's. If you find yourself in a moment of misalignment with the family's values, try to set up a transparent conversation about that. Use respectful language to be honest about how that misalignment happened and set up expectations from then. That will help develop trust between you and the family. We want to make sure we have meaningful relationships with all of our families so that they can support the health and wellness of their children. This includes multicultural and multilingual families. It's important for us to be flexible in our practices as we go. If you're interested in wanting to learn more about applying these practices, for example, modeling EI practices in your work or improving family engagement, you can take a look online at different trainings or professional developments offered by the University of Kentucky and the University of North Carolina. The website is called Connect Modules. These are trainings that are specifically centered on providers that work with families with children with disabilities. They have different categories of trainings, including how to talk with families. To further support the collaboration process, you can also talk with your supervisor and colleagues about family engagement practices at your school. You can discuss new ideas to pursue and how best to engage different types of families. You might want to write a script for your staff. Using a script that's very positive, that has word choice and language that is positive, can help pursue positive family engagement. Think about how to engage families better at your school in particular. Every student's family is welcome to partner with you. Assume that every family wants the best for their children. These families rely on your expertise, so engage with them to make sure that you're making decisions together about their children. Communicate often with families. Keep communication positive. Ask families how they prefer to communicate, through video phone, telephone, text message, or written language, and follow their preferences. Be sure to include the use of translators if that's necessary for multilingual families. Collaborate with community organizations that can support these families. Learn what happens in the classroom, at home, and in the community. Connect families to available resources. These can help improve educational experiences. As you begin or continue to work with families, we want to be sure that you are supporting family engagement by keeping a list of available resources for your families. Take some time to do some research in your community. Some examples are Cradles to Crayons. This is an organization that provides clothing and basic needs for children under the age of 12. We also have CAP for Kids in our area, but there are a number of resources available in specific communities that you should know about. There are also infant mental health organizations that provide trainings and professional opportunities to better understand the impacts of development on children starting at very young ages. Take the time to find out where these resources are in your community. Another way is through your public broadcasting system, PBS. They offer information to your community that you can use to share with your families. Each area is different, so be sure to do this research and have a list available if a family needs support for their basic needs. As you begin to do this research on the resources in your community, or if you already have it, you may feel like you're not sure where to begin. We've provided you this map of classifying needs as a handout. This follows Maslow's hierarchy of needs, roughly, to help us set these categories. You can make this for yourself, taking a look at Maslow's hierarchy, starting with physiological needs and moving from there. Physiological needs include finding housing or shelter, making sure that someone has access to food and clothing, both for children and for adults. Moving up from there on Maslow's hierarchy, safety needs that could be related to domestic violence, law enforcement. It could be related to medical care, especially when we think about immigrant and refugee populations. We also need to think about access to medical care in an appropriate language and health insurance. Next up on Maslow's hierarchy, love and care. That could include therapy and other resources. So think about different hotlines or crisis centers that may apply in different areas on Maslow's hierarchy. If you have a social worker on staff at your school, they may be a great resource for you. They may already know of organizations in your community and provide you a list. If you don't have a social worker, look in your community so that you can provide that to the families in your school. We want to thank you for your passion, dedication, and willingness to invest back into our deaf and hard of hearing children's future. By promoting family engagement and developing positive relationships with families that we work with, we can help ensure that our deaf and hard of hearing children will grow into future leaders. This conversation continues. We would love to hear from you. Your thoughts, ideas, and comments or feedback are welcome. You can contact us through email. We look forward to hearing from you. Bye.